I Understand.
Cesarean delivery, also known as a C-section, is a surgical procedure used to deliver a baby through incisions in the mother's abdomen and uterus. A C-section might be planned ahead of time, but often the need for a C-section does not become obvious until you are in labor. Sometimes a C-section is safer for you or your baby than is a vaginal delivery, and your doctor might recommend a C-section in several cases. For example, when your labor isn't progressing, so when your cervix isn't opening enough despite strong contractions over several hours. Also, when your baby isn't getting enough oxygen, for example, when there is a problem with the umbilical cord or the placenta. When your baby or babies are in an abnormal position. If you're carrying multiples, normally we would do a C-section as well. There's a problem with your placenta. For example, if the placenta covers the opening of the cervix, we call it placenta previa, and in this case, we will have to do a C-section. If you have a health condition, like complex heart problems, high blood pressure requiring urgent delivery, or an infection that could be passed to your baby during vaginal delivery, like genital herpes or HIV, in this case, we also need a C-section. If there's mechanical obstruction, you might need a C-section if you have a large fibroid obstructing the birth canal, or a severely displaced pelvic fracture, or your baby has a very large head. If you've had a previous C-section, depending on the type of uterine incision and other factors, it's often possible to attempt vaginal birth after a previous C-section, but in some cases, however, your doctor might recommend a repeat C-section. Some women request C-sections with their first babies to avoid labor or the possible complications of a vaginal birth, or to take advantage of the convenience of a planned delivery. However, this is discouraged if you plan on having several children. If your C-section is scheduled in advance, certain blood tests will provide information about your blood type and your level of hemoglobin. These details will be helpful in the unlikely event that you need a blood transfusion during a C-section. If your C-section is planned before 39 weeks for a non-emergency reason, your baby's lungs maturity might be tested before the C-section. This is done with amniocentesis, which is a procedure in which a sample of the amniotic fluid is removed from the uterus for testing. Maturity amniocentesis can offer assurance that the baby is ready for birth. Even if you're planning a vaginal birth, it's important to prepare for the unexpected. So discuss the possibility of a C-section with your healthcare provider well before your due date. After a C-section, you will need time to rest and recover. Consider recruiting help ahead of time for the weeks following the birth of your baby. While the process can vary depending on why the procedure is being done, most sections involve these steps. Number one, preparation at home. So at home, take a shower. Don't shave your pubic hair. This can increase the risk of surgical site infection, so don't do it. If your pubic hair needs to be removed, it will be trimmed just before the surgery. At the hospital, before your C-section, your abdomen will be cleansed. A tube called catheter will likely be placed into the bladder to collect urine. Intravenous lines will be placed in a vein in your hand or arm to provide fluid and medication. You might be given an antacid to reduce the risk of an upset stomach during the procedure. Most C-sections are done under regional anesthesia, which numbs only the lower part of your body, allowing to remain awake during the procedure. A common choice is a spinal block, in which pain medication is injected directly into the sac surrounding your spinal cord. In an emergency, general anesthesia is sometimes needed. The doctor will make an incision through your abdominal wall. It is usually done horizontally near the pubic hairline, called the bikini incision. If a large incision is needed or your baby must be delivered very quickly, the doctor might make a vertical incision from just below the navel to just above the pubic bone. Your doctor will then make incisions, layer by layer, through your fatty tissue and connective tissue, and separate the abdominal muscles to access your abdominal cavity. The uterine incision is then made, usually horizontally across the lower part of the uterus. It's called low transverse incision. Other types of uterine incisions might be used depending on the baby's position within the uterus and whether you have complications such as placenta previa. The baby will be delivered through the incisions. The doctor will clear your baby's mouth and nose of fluids, then clamp and cut the umbilical cord. The placenta will be removed from the uterus, and the incisions will be closed with sutures. Soon after your C-section, you'll be encouraged to get up and walk. This will help prevent constipation and DVT. You'll be monitored for signs of infection, how much fluid you're drinking, and bladder and bowel function. You'll be able to start breastfeeding as soon as you feel up to it. A nurse or a lactation consultant will teach you how to position yourself and support your baby so that you are comfortable and happy with the breastfeeding. Your healthcare team will select medications for you for post-surgical pain with breastfeeding in mind. Pain control is important since pain interferes with the release of oxytocin, which is a hormone that helps you make milk and make it flow. When you go home while recovering, take it easy. Rest when possible, get help from the family, and for the first few weeks, avoid lifting anything heavier than your baby. Support your abdomen. Use pillows for extra support while breastfeeding, straining, or cuffing. A pregnancy belt might provide additional support, but it's not necessary. Drink plenty of fluids. Drinking water and other fluids can help replace the fluid lost during delivery and breastfeeding, as well as prevent constipation and make you heal faster. Take medication as needed. Most pain relief medications are safe for women who are breastfeeding, but avoid aspirin. Avoid sex. Don't have sex until 4 to 6 weeks after surgery. But remember to spend some time with your partner, express your love to each other, even if it's just a few minutes in the morning or after the baby goes to sleep at night. Contact your healthcare provider if you experience any signs of infection, such as fever higher than 38 degrees Celsius, severe pain in your abdomen or redness, swelling, and discharge at your incision site, breast pain accompanied by redness or fever, foul-smelling vaginal discharge, painful urination, heavy bleeding that soaks a sanitary napkin within an hour, or bleeding that continues longer than 8 weeks after delivery. Also, postpartum depression signs. For example, if you notice any mood swings, loss of appetite, overwhelming fatigue, or lack of joy in life, please contact your doctor. Wishing you a speedy recovery and a happy new role in life. This video contains general information about medical conditions. The content might not be suitable for everyone and should not be treated as such. Always consult your doctor before using medications. The medical information is provided without any warranties or legal obligations to those who might apply them.